Welcome to the benefit concert for Well One Health. My name is Pastor Tara Van Cross, and I'm here on Azure Hills Church campus. We are so moved by the incredible work that Well One Health has been doing for this community. Dr. Tracy Dawes and her team have been serving double the number of people since COVID hit, and the needs are great. They're seeking to meet those needs. So today, as you are blessed by incredible music and testimony, you're also going to have the chance to give. You're going to have the chance to make sure that people have access to caring, professional health care. I invite you to pray as we now engage together in this inspiring and moving concert. Dear God, we thank you so much for the incredible and skilled health professionals that continue to serve our community. We thank you so much for the chance to hear music and testimony today. We pray that you would multiply all that which comes in today and that you would lift us up, whatever anyone is going through right now as they hear these songs and hear this word, that you would also raise us up with courage and strength. In the name of Jesus, amen. Enjoy.
Well, good evening, everyone. My name is Dr. Tracy Dawes. I'm the founder and executive director of Well One Health Free Clinic, which is operated from the Lake Paris Seventh-day Adventist Church in the city of Paris. We have locations both in San Bernardino churches as well as in the city of Paris. We just want to welcome you today to our first annual benefit concert. And I just want to let you know that this concert will benefit our patients. Those that we serve are uninsured and underinsured, and 100% of your donations from the concert will go towards taking care of our patients' medical bills. We hope that you enjoy the program we have planned for you, and we want to wish you and your loved ones a happy holiday. everyone. Welcome to Well One Health Free Clinic. You are standing in the only exam room that we have. And the tour is really short because it's a really small space. And in this small space, we pack everything in, like supplies. For example, on this side, we have a locker that was donated to us by students and repainted by students. And here we have supplies, diabetes supplies, blood pressure supplies for patients who cannot afford it. And on this side, we have another locker. And in here, we also have anything that we need for office use, so printing paper, etc. Those are things that we use every day and they run out pretty quickly. And if you come on over here, or curtains, this is our partition between our supply area and the actual clinic space in which we see patients. And as you can see, our examination bed and our 2 nurse practitioner students who are with us today. And this is the end of the exam room. Behind here, we have women's health supplies because we need that whenever we run a PAP clinic. And over here, more supplies again, anything that patients need. We also have pack supplies about once a month for the homeless population. We pass out shampoos and lotions and anything that they may need while they're out in the open. And so whenever you look around our clinic, everything you see in the space has been donated to us. And the services that are provided with students and also volunteers. And so what we're asking is that you give us the chance to serve more people by donating whatever supplies that you can. Go to our Amazon wish list, select something that you can afford and have it shipped to us. But if you can't do that, feel free to send us some money by going to our website and donating through our webpage, well1health.org.
Hi, my name is Kathleen. I've been volunteering at Well One for about 8 weeks now. Here at the clinic, we serve the community. It's a free clinic, so donations mean a lot. Some of those donations can be life-saving to some of the patients that we see that come in here, and they're really appreciated. Our professor, Dr. Tracy Dawes, she's amazing. She's one of the nicest people I have ever met, and she truly does this because her heart is in it and she wants to help people that need the help, that come in here every Friday for just primary care stuff, really, because they can't even afford that. And this clinic gives them the opportunity to get the treatment and to maintain their health, and ultimately saves the community money as a whole and eliminates kind of the emergency situations.
Christ was born. Oh, night divine, oh, night divine.
The first time I came to the city of Paris, I was a doctoral student at Loma Linda University in public health, and I had a part-time job as a tutor. And I was working with elementary students, helping them improve their reading skills. I would meet them at the library, or I'd meet them in their homes. And we would meet about 2 or 3 evenings per week over a course of a semester so that they can improve their skills. And it's during that time that I realized, wow, this is a really underserved city and there's a whole lot of work that could be done. And so in 2014, I did a needs assessment of the area and realized the great need for public health professionals, for healthcare professionals, and that spurred the idea of making sure the clinic would be here. I grew up in Jamaica. I grew up in a rural farming community, which was very poor. I know what it's like to be on food stamps. I know what it's like to go to bed with multiple days without meals. And I saw my parents out of nothing provide for others. So I grew up understanding that we have an obligation to our community. When I came to this country, I have now become one of those with privilege. I have health insurance, I have the money to take care of my family, and I have the education that allows me to help others. I'm using what I have, the blessings I've been afforded, to help somebody else. When I thought about starting a clinic, there's so many people that I talked about, asked questions of, and I remember looking for a church, and I was directed to the Paris 5th Street Church, to Pastor Wade Ford. And I remember showing up on his office doorstep and saying, "Hi, my name is Tracy. I'm looking for some space to put a free clinic." And he said, "Come on in. We've been waiting for someone like you because we saw the need, but we just didn't know how to start." So he went, spoke with the church board, and they got on board with the whole thing, and we started the clinic October 21st in 2015, right there in the Paris 5th Street Church. The whole act of opening a clinic, it's easy when said, but a very difficult process. Of course, there's a process of setting up the nonprofit. That was the easy part. The difficult part is finding volunteers. And we found that what worked best was to go from regular volunteers and turn it into a student-run clinic, meaning it's a nurse-managed clinic, but our students are the ones who are doing the everyday work. We also got burglarized twice, lost everything, and had to close for about 8 months while we come up with some money to purchase all the equipment again. Of course, COVID has made things even worse because our patients are scattered all over, and it is very difficult to get in touch with them sometimes if they've changed jobs or moved addresses. So there's some difficulties finding a space that's large enough to accommodate the growing population of patients. That's also a challenge.
need a friend to be there till the end of time. I wonder if he knew no gift under a tree could imitate that silent night. I wonder if he knew they turn their backs on him and leave him all alone to die. I wonder if he knew he'd be the Son of Man, a ransom paid for all mankind. And that's why he was born for me. Baby Jesus born for me. In a manger born for me. Ain't it great that this Christmas Jesus Christ was born for me? I wonder if he knew that one day I would need much more than Christmas trees with lights. I wonder if he knew no Santa on a sleigh could wash away my pain, even if he tried. I wonder if he knew the world would need a king willing to suffer, bleed, and die. I wonder if he knew that he would be my hope, my everything, my morning light. And that's why he was born for me. Baby Jesus born for me. In a manger born for me. Ain't it great that this Christmas Jesus Christ was born? Silent night, holy night, all is calm, all is bright. Angels sing from on high. Jesus the greatest gift alive, born for me. Baby Jesus born for me. In a manger born for me. Ain't it bright that this Christmas Jesus Christ was born for me? Jesus Christ was born for me.
Hi, everybody. My name is Samantha, aka Free. You can find me on social media at I Am Free Music. And I just wanted to say I love you guys so much, wherever you are. I know this has been a rough year, but God really put it on my heart to record this song live for you all. I just wanted to be a light in this dark time that we're living in, and I pray that it encourages you. And no matter what you're going through, just know that there is somebody named Jesus that you can call on, and he will hear you, and he loves you so much. Have a merry, merry, merry Christmas, and God bless.
So, joining us today, we have Kim and Maria, and I'm just going to give them a chance to introduce themselves because they have played a very important role in our clinic. Kim, tell us a little bit about yourself.
So my name is Kimberly Shoy. I went to the school of Cal Baptist University here in Riverside, and I was an intern student at the Well One Health Clinic.
Maria?
Hi, my name is Maria Dominguez. I was also Dr. Dawes' student at National University, where I interned at the clinic, and we got to help a lot of the smaller communities out there.
So, ladies, tell me a little bit about your role. Kimberly, what did you do at the clinic?
So at the clinic, I was basically just an intern, working as under Dr. Dawes. She was my preceptor as a nurse practitioner student, and we just basically helped the community that's out there, which is like Hispanic people, minorities basically. And my role was there is to provide care under, of course, Dr. Dawes' supervision. Um, and that's basically what we did.
And Maria, you had an interesting role because number one, you were my community health nursing student and leadership student, but also you got to be in the inside. That means you're actually in the room with us. What was your role in the patient room?
So my role was pretty much like back office, front office. I helped Kim or the other nurse practitioner or you as well set up the rooms for the patients. I would also translate for them. A lot of our population was Hispanic, and most of the time they didn't speak the language. So I would help them feel comfortable in asking questions because a lot of the times they were afraid to ask questions or didn't know if it was okay. So I just made sure to help them understand that we're there for them. I also helped in the front, helped with check-in because all of our patients were Hispanic, and just asked them and let them know, like, we're here to help you. What can we do? Just let us know what other ways or what other resources we can help you with.
And that was a very good thing that you mentioned because our patient population is actually over 98% Hispanic and over 70% speak Spanish only at home, which means when they walk into clinic, it's very important for them to see someone who represents their culture and understands what their needs are. It also helps that they don't have to keep repeating the same thing over and over to different providers because we had a consistent set of nurse practitioner students there and nurse practitioners who were familiar with the patients. Kimberly, what was important for you? What did you learn? What's the most important thing you learned while you were interning at our clinic?
The most important thing that I learned, and it's sad to see that a lot of the people just walking out there are coming in with high blood pressures and they're just walking and they haven't seen a provider for so long. I've learned that, just providing some care, it was we did a lot there, but for the people that are just coming in to us, they're so grateful to get some type of just, even if it's just talking to somebody, like with the depression that's going on with the COVID, or just, talking about the headaches that eventually become always a blood pressure issue that they're just walking around with. I've just learned there's just a lot of morbidities out there that we just don't know because they don't see providers, so these patients. So that's what I've taken. That we really need. There's a big need out there to be able to see these patients.
Sophia, you have lived, this is your culture as well. What are some of the reasons why patients don't go? Because we have federally qualified health centers. They can go to the county hospital. Share with us some of the reasons these patients come to us instead of choosing to go to other locations.
I feel a lot of it has to do with our culture. I grew up as a minority. We were also illegal, and I remember not ever going to the doctor's office. We never went to physicals. It wasn't until I started in the medical field that I learned that you're supposed to go every year. Your parents are supposed to be checked every year. And when I spoke to my parents about it, they said, we were living in fear. We didn't know if they were going to report us when we came to this country to help our kids. And when I spoke to those patients, a lot of them are here illegally, and they're just trying to do better for themselves and their families. Or unless, it's sad to say, but unless you feel like you're dying, you just don't go to the doctor's office. Most of the time, financially, we can't afford it, or it's just hearsay, like, oh, a family friend told me this, like maybe try this remedy, So I try and tell the patients and let everyone know, come here, we're here to help you guys, to help the community. I've been there personally where we didn't have money and we just waited it out and prayed for the best. And I feel personally, because this is my community and it's my people, I just try and make them feel as comfortable as possible. And like you said, they like consistency. They like seeing Kim there, and they love you. They're always very happy when they receive a phone call from you. So I just feel that if we educate patients, like, this is what you look out for. If you need help, just give us a call or come to the clinic. I think through education, it will help the community.
And I'll take a moment right now to pause and talk a little bit about our financial situation. Typically, clinics would need hundreds of thousands of dollars to operate, but we operate solely on volunteers, meaning students who need to complete their practicum hours for nursing, for public health, and for other disciplines as well. And also, we have a few volunteers who are from the community, for example, or some of our translators are from the community. We do also have students who are interested in going to medical school, going to nursing school, who come in as a part of their shadowing so that they can get some exposure to the field before making that decision. So it is important to give, because many of our patients, and at this moment I have to say that during COVID, we double the number of patients that we were seeing previously. Between, I would say, late June to early November, we were almost up to 300 patients. And that's 300 discrete patients. But that means multiple visits, because for every chronic disease, we expect to see our patients at least once every 3 months. And follow-up can be even more frequent. We do pay for labs and imaging for our patients who are unable to do so. And sometimes we pay for transportation for them to get to the clinic in the first place. This costs quite a bit, as you can imagine. And so we want to give you an opportunity to donate to our clinic. I just want to share with you some of the ways that you can do that. You can go directly to our website at well1health.com. That is WELLONEHEALTH, well1health.com. And you'll find a donate button, a green donate button at the top right-hand corner of your screen. You can also do Venmo. That's pretty quick and easy on an app at Well1-Health Clinic. And also at Cash App, $Well1Health. You will also find a donate button on our Facebook page, and you can give there as well. What you'll be given towards will be helping those who are uninsured and underinsured, people who are on Medicare, Medicaid, who are in what we call the donut hole. They've spent all that they can, and they just need a little bit of assistance. So we're talking about our seniors and the very young. So if you can find it in your hearts today, we'd like you to consider a donation to Well1 Health to help those who are not able to help themselves.
benedictus fructus ventris, ventris tui, Jesus. Ave Mater Dei, ora pro nobis peccatoribus, ora pro nobis, ora pro nobis peccatoribus, nunc et in hora mortis, in hora mortis nostri, in hora mortis nostri, in hora mortis nostri. Ave Dominus tecum, benedicta tu in mulieribus, et benedictus fructus ventris, ventris tui, Jesus. Ave
Hi there, my name is James. I'm a student with National University and I volunteer here at the Well One Clinic. I can't stress enough the good that happens here. I come here not only because I need to for school, but I'm today's going to be the last day that I have to come, and I've already made arrangements to continue to come here because of the good that goes on. We really could use some help in making sure that we can continue on. It's not just the volunteers, but it's keeping the lights on. It's doing the things that we need to do to continue to help people out. We give people free medicine when we need to. We all step up and do what we can, but the more help we can get, the better. Dr. Dawes is doing some beautiful things, and we need to make sure that we do everything we can to help her do that in this community. Because every community needs it, but this community needs it just a little bit more.
So I was blessed to work with Dr. Dawes as one of her interpreters. There's a couple of us that are fluent in Spanish. So with that, I had the blessing of just seeing her interact with her patients. And she's really, really knowledgeable, but she's also really, really compassionate. She embodies empathy and what it means to be a nurse for the right reasons. And she tries to speak with them in their language. She tries to instill that confidence, and she never makes them feel any less or inferior if they don't have the means to pay for the services provided. And I think that's when I realized I liked her because she was really knowledgeable, but that's when I really, really liked her because I saw her true practice of empathy. I believe I started in June, possibly, when we started our community clinical. And even though it's a long drive, what made me want to come back was that she was just her compassion for her patients. And I do appreciate that there's groups and clinics that provide that service for served communities, and as a Latina myself, like I really appreciate providers that care, that care to provide that, like besides like, whatever race you are, whatever, economic background you have, that the services are there provided. And so seeing Dr. Dawes do that, like it's worth the trip, it's worth the experience, it's worth like the heat and everything, but just seeing how she truly like embodies like the true compassion of being a nurse made me come back.
María, ¿sabes qué? Tu bebé caminará en las aguas. María, ¿sabes qué? Que tu bebé salvará las almas. ¿Sabes qué? A través de él tú renacerás. Y ese niño que hoy cuidas ha venido a salvar. María, ¿sabes qué? Que tu bebé dará la vista al ciego. María, ¿sabes qué? Tu bebé calmará la tormenta. ¿Sabes qué? Que él caminó con los ángeles del cielo. Cuando besas su mejilla, besas el rostro de Dios. El ciego verá, el sordo oirá, y los muertos vivirán. Los mudos también, ellos cantarán la gloria del Señor. María, ¿sabes qué? Tu bebé creó el universo. María, ¿sabes qué? Tu bebé gobernará el mundo. ¿Sabes qué? Que tu bebé del cielo descendió. Y ese niño en tus brazos es el gran yo soy. María, ¿sabes qué?
Es Elisa Centeno y yo estoy contenta con esta clínica porque me atiende mucho la señorita, la doctora y todas las muchachas, y con la comida también me alimento muy bien, y gracias a Dios y a ella ya estoy mejor. Véngase usted también. Gracias a Dios y a ella mi enfermedad está controlada.
We offer typical family medicine services, so we will see adults mostly, hardly any children unless it's summer vacation and they're coming to get cleared for school. We have women's health services. We do have specifically days when we offer pap smear days because our population is pretty underserved where that is concerned. We also offer dental, although we're closed now during COVID. So it's medical, dental. We have added mental health services as well. Patient advocacy, meaning if patients need someone to speak on their behalf to a pharmacist, to another doctor, we are that liaison, that connection between the patient and their other healthcare providers. We are that connection between them and the hospital when they need someone to speak up for them. We help them complete health insurance forms, other legal forms if they have no one to help them with that. Currently, our patient population is over 98% Hispanic, and I'd say 85% females. We're seeing mostly women between the ages of about 30 and 80 years old. And we have persons who, most of them do not speak English. We do have persons who have absolutely no means of getting healthcare, meaning they have no health insurance and do not qualify for health insurance. So that's the patient population we have. So we're open at the Lake Paris Seventh-day Adventist Church, which is at 380 West 3rd Street in the city of Paris, every Friday from 8 to 2. We usually take our last patient at 1:30, but there are days when we're here until 3 o'clock because we're here to fill the need. Donations are the way that this clinic functions. We need donations, first of all, because our patients cannot afford healthcare, so they need money to pay for imaging. Small things just like transportation, getting a bus pass to get to clinic, even paying for their prescription medications. Donations would go a long way towards that. In fact, a donation of $35 will actually pay for the most basic labs that each person will need. It costs more for other things, but at the very least, $35 will pay for one person's labs. Donations would also mean that we start putting money aside so that we can actually afford a space that we can move into to accommodate the number of patients we're now seeing. Nobody gets paid. Those of us who show up, we do this because we believe that healthcare is a human right, so no one gets paid. So every cent that you donate, 100% goes towards patient care. Nobody here gets paid.
What child is this who later Mary, did you know?
So, Kimberly, tell us a little bit about, tell our listeners a little bit about why donating to this community is important, and especially to our Hispanic listeners, because we do have a vibrant community of Hispanic listeners at the moment.
Right. It's very important to donate to the Well One Health Clinic. The reason for is because there's a lot of people out there that are just walking around with issues, and they're just like Maria said, they're not coming forth. But when they do find out about the clinic, they do come in, and we're like Dr. Dawes says, we're at the capacity, and sometimes we don't have the supplies, and so sometimes we bring supplies from home, but that's not the case all the time. So we do need donations to keep supporting the Dr. Dawes' mission, so we could continue to do the work that we're doing now. So, la razón que necesitamos la ayuda de ustedes, necesitamos que personas que donen, porque la clínica no necesitamos el equipo que podemos usar para cuando miramos los pacientes. Hay muchos pacientes que están caminando ahí en la calle sin poder mirar una doctora o los estudiantes que tenemos que acá. Y solo necesitamos su ayuda para poder seguir la misión que Dr. Dawes que ella tiene, y es para que podamos ayudar a las personas de la comunidad.
En la manera que pueden donar es, si tienen Facebook, pueden ir a la página de Well One Health Clinic. Lo que tienen que hacer es irse a la página o al web, que es el wellonehealth.com. Y si van a la página de Facebook, ahí tiene un botón donde pueden donar ahí en la esquina. También nosotros aceptamos Venmo, y si nos buscan sería a @wellone Health Clinic. So, de nuevo es @wellone Health Clinic, que es el nombre de la clínica. Otro app que pueden donar con es el Cash App. Solo pueden buscar con la seña del dinero, y luego sería Well One Health. De nuevo, si pueden ir a la página de Facebook para ayudar con lo que puedan, para ayudar a la comunidad. Como dijo Kim, tenemos muchos pacientes que son hispanos. Y necesitan nuestra ayuda. A veces conocemos a familia que no tiene aseguranza, y si los recomiendan a esta clínica, con lo que ustedes donen, pueden ayudar a sus amigos o a sus familiares.
Hi, my name is Eric. I'm been a pharmacy tech for about 18 years and currently working as a CNA. You know, the community and even locations like Moreno Valley, Riverside, it's needed. There's a lot of people that are low on resources or money and things like that, and you guys are providing that help to them. Even the nursing students that are here volunteering their time, it helps them get those clinical skills. So I think that's very important. Not just talking to people, providing their interpreting services for them, but calling on the phone and finding out what may have happened to them or what is currently happening to them. Sometimes the doctor's looking to get kind of feedback in regard to like a follow-up with the patient. Sometimes they don't come in, or maybe you do get them on the phone and they still need some help. They still need some help. So it's good when you see them come back and then they're getting some more help that they need, and they tell me that they would like to have our doctor as their primary care physician, and they have a lot of faith in the doctor, and that if it wasn't for this doctor and the services that she provides here at the clinic, they'd probably have a bad outcome or possibly death.
We hope that you enjoyed our program today. We just want to thank you so much for donating to our cause. We also want to remind you, if you have not yet had a chance to donate, that you may do so through our website at well1health.com. That's well1health.com. And the donate button will be that green button at the top right-hand corner of the screen. You can also donate through Venmo at Well1-Health Clinic. That's at Well1-Health Clinic. Also through Cash App, $Well1 Health. And you can also donate directly through our Facebook page. Just look for the donate button. And of course, we wish you and your loved ones happy holidays.